I just wanted to get on here and answer the question of what should I expect in a first session, because I know that that is a major reason why people do not start therapy or worry about starting therapy, because of the anxiety of just like, I have no idea what I'm getting myself into, and I don't really know what is going to happen. And because of that fear of the unknown, it kind of keeps people thinking that there is some major stigma or taboo around the idea of starting therapy, when in fact it is a very, very usually smooth process. And if it's a good therapist, they're going to be really good about kind of breaking that fear, initial fear that you have, and helping you kind of transition into the rhythm of therapy pretty quickly. So let's just talk about the first session. So usually what you will expect is a therapist will have a room that feels a little bit cozy, likely a couch with a blanket and some pillows, and usually the setting is pretty calm and relaxed for the most part. When you first come in, you're really just have in mind that the initial session is really just about for the therapist, it's really about the therapist gathering information about the client and the presenting problem. So whatever it is that has triggered you to start the process of therapy, whether it's preventative work or it's crisis intervention or whatever, your therapist is really there to just start to dig a little bit and get some questions answered. And we really call this the intake process. Intake is just gathering historical information about the presenting problem, and then some other points here and there, such as trauma history or family history of mental illness or substance use issues, all of that. So there'll be quite a lot of questions in that first session, and really it is just to gather some context around your presenting problem, so that we can kind of understand the psychology and the kind of nitty-gritty of what has sort of led to the struggles that you're facing in the present moment. So we call that intake. And then from the client's perspective, so sitting on the other side of things, usually because you're a little nervous and you're a little worried and a little on edge, especially if you've never done or gone to a counselor or therapist before, you probably have a lot of questions. You don't know what to expect. So again, what I would suggest is really just taking that session to kind of get a feel for the therapist, kind of see how you feel. If it's a good therapist, most likely you'll feel pretty comfortable, you'll feel pretty relaxed. You'll be able to ask any questions that you have. So if you have concerns about the process, if you have concerns about confidentiality, if you're a parent and you don't know how you're gonna learn about what's going on with your teen that you're bringing for therapy, those would be great kind of points to bring up, after the intake process has been complete. So, and then one of the initial things that is done also in a first session is what we call the informed consent, and just kind of reviewing the therapy office and the practices, kind of their kind of rules and regulations and policies around different things like cancellation or how to schedule appointments. So all of those things kind of just get reiterated. And then, of course, talking a little bit about the process of confidentiality and the exceptions to the rule of confidentiality. So when does confidentiality need to be broken in the situations like suicidal ideations or things like that. So all of that really much, for the most part, happens in the first session. And sometimes therapists might take a couple of sessions to complete the intake process, but usually it's pretty relaxed. Like I said, from our vantage point, we're just there to understand you, kind of help build trust a little bit by kind of just asking you some questions, getting some context, giving you some information about our practice, and then kind of opening it up to your own thoughts, questions, just kind of an introduction to the process. And usually as the client, you're sitting and you're going to feel a certain way kind of pretty quickly in the therapy session. So if you're already kind of feeling like, oh, this is not good, I don't feel comfortable, I don't feel safe. If any of those things are happening in the first session, then most likely it's not going to be the right fit. But I would absolutely just say stick it out for that first session and just kind of see how it feels. And if it's a therapist for your child or your teen or a family member and you're present because it's sort of a family intake, then again, just paying attention to the same types of things. So hopefully that's helpful. Just relax, everything's gonna be okay. I promise that you're gonna feel a sense of like this is the right fit by session 1, 2, and once you break that barrier again, because there's really nothing to be scared of in our offices. They're very relaxing, super calm. The lighting's usually pretty low key. And then you can start the journey, and it just feels really good to get started. I know that from personal experience. So hopefully that's helpful. And yeah, have a good day.